Coming up, can lawmakers agree on health care reform before their recess this week? Congressman Buchanan says not likely. We'll hear from him when we return.
Now, SNN Local News 6.
It is legislation that could affect each and every one of us, yet reforming health care is so complex. Coming up with the right plan is proving to be challenging not only for lawmakers, but for many of us to understand. To shed some light on the subject is District 13 Congressman Buchanan. Thank you so much for joining us. This is really the hot topic of not only the day, but the week and months behind us and also ahead. I guess let's first start with this. Are you in favor of health care reform? Why or why not?
I'm completely 110% for health care reform. We've got to reform it. I'm a guy that's been in business 30 years. I bought a lot of health care 3 years ago. I think we had 1,200 employees. It's gone up. I'm in the recent memory 20–25% a year. Nobody can afford it.
What do you like about the president's plan?
The biggest overall thing is that he started the discussion. I think that's critical. From that standpoint. You can't get to lowering costs in health care. I've talked to doctors, hospitals, everybody, unless you take on tort and legal reform.
Is that something you're in favor of? Or?
Yes, we need to take on tort and legal reform because a lot of doctors have to practice defensive medicine. They have to run a lot more tests. I've talked to neurosurgeons. It's $200,000 a year. Before they turn on the lights, they pay rent, anything. That gets passed on to the system. So you have to deal with legal and tort reform. You have to deal with, I think, having associations like realtors and home builders where they can pull their resources and buy it less expensive.
The president says that he will not sign any major health care reform that would create a deficit or add to this deficit. He wants it to be budget neutral, as he said in his press conference last week. He says 2/3 would be paid for by reallocating tax dollars that are already in the federal system. He says the final third could be raised by limiting itemized deductions for the wealthiest Americans. Now, a House version of that said there could be a surtax on families making $1 million plus per year. Is that a surtax that you would support in order to pay for the health care reform?
Not at this time, because it affects, most small businesses that have 50 to 100, 200 employees, that's who they're talking about paying the tax. Most small businesses have pass-through income. They have, whether it's a car dealership or a realty company, those are all pass-through incomes to them personally. So it's going to affect them. It's going to, there are maybe some people that have a big trust fund. You know, if they're going to tax them, that's their business, but that wouldn't be something I'd want to do. But to tax small business owners, that's who's going to pay that tax, plus the 8% on payroll. I just think right now, to be taxing more people, what we need to do is figure out how to get the cost down of health care, because I honestly feel unless they deal with that.
How do you do it then?
Well, they have to take, everybody's got to come to the table. Hospitals, doctors, the trial lawyers, insurance companies, drug companies, all the players have to come to the table, and we've got to figure out a way to get their cost of delivering the service down.
Let's talk about prescription drugs, because I actually do a segment, it's called the Senior Squad, where we talk about issues facing our seniors. By far, healthcare prescription drug costs are the biggest things on their minds right now. So how is that being addressed in the debate going on in Congress right now with this reform?
Again, they are dealing with the the drug companies. I know they've been over there. They have made some suggestions. I think there's a lot more that needs to be done, frankly, with the drug companies, because my parents, or a lot of seniors I see, they take 5, 6 drugs a month. We've got to find a way to get that cost down substantially.
What is your sense of timing on this? Are we looking at the end of the year, realistically, when we're going to see some major legislation?
I'd like to see major reform by the end of the year. I think that's realistic, and then, you know, people are concerned about their own elections maybe in 2010, but if we get it done by the end of the year and get it done right, that's what the American people are going to want.
Well, we'll certainly be watching. Congressman, thank you so much for joining us. Really appreciate it.
Thank you. Appreciate it.
Pleasure. All right, and we will be back with much more news and weather right after this quick break. You're watching SNN Local News 6.